Hey, I'm Dr. Randy, here to talk about TMJ replacement for one of our patients who had it done about 1.5 years, almost 2 years ago. And who needs TMJ replacement? Essentially someone who has some degeneration or resorption or changes in their jaw joint where you notice that with the lower jaw starting to fall back. And patients mainly notice it when they're trying to eat and all of a sudden they realize they can't bite into food anymore because their front teeth are open, and then they experience quite a bit of pain and start having some sleep issues where they're having some sleep apnea. And what we end up doing is getting a custom-made joint that is used to replicate and create a new prosthesis in the TMJ region where this area as well as the jaw joint is all replaced with a custom-made prosthetic joint. And about 1.5 years out, braces are off, looking good. How are you doing?
Good. I've seen so much change in just like the way I talk, sleep, eat. I finally sleep through the night. I have no more anxiety. My jaw doesn't lock up.